everyone. So I'm here with another video, and I'm with another person, another young person who's been impacted by cancer in their lives. And I've got Kaela, and we're going to be, talking about her diagnosis and her cancer treatment story, but also talking about her choice to continue being an oncology nurse, which to me just sounds, seems crazy. And I'm just so amazed by you, Kaela. So let's get started. So what cancer were you diagnosed with, and what's your cancer treatment journey so far?
So 2020, late Jan, I was diagnosed with a synovial sarcoma in my right groin. I had surgery intervention followed by intensive chemotherapy for almost 5 months. Had a 3-week break, and then I went into radiation 5 days a week for nearly 3 months.
Yeah, wow.
Yeah.
And so when did that end?
I think August
last year.
Yeah. Still winding up and feeling the effects from the radiation. But yeah, nice and toasty on my leg.
Yeah. Since August, have you had follow-up scans? Do you know if you are in remission, if you're still in remission?
So the unfortunate thing with sarcoma, sarcoma is a really rare cancer. It's a soft tissue cancer. It affects approximately 1 in a million people. The downside, apart from the fact that it's cancer, is I can't actually be in remission for 5 years because of the likelihood of it coming back. So I may be wrong, but I believe even with the treatment I've had, it's still a 68% chance of coming back. So that requires me to have 3 monthly scans for 2 years. So it alternates between leg MRI, which is where my primary tumor was, and lung CT, because sarcoma likes to travel to the lungs. And it will alternate between those 2 scans on the one day, and then the following 3 months, it'll be a full body PET scan. And we just keep going like that every 3 months for 2 years, and then 6 monthly for a consecutive 3 years. And then if I'm clear in 5 years, then I can go into remission.
I see.
It's really difficult because people say, like, are you okay? It's like, well, I don't know.
Yeah.
Like for this 3 months, I'm fine.
Yeah, that's really hard, especially with those rates of like relapsing. It must be, it's already, I remember being incredibly scared and anxious going towards my 3 months or 6 month scans, but I can't imagine just knowing that rate of relapse. It must be really hard, and that you can't even use the word remission until 5 years.
Yeah, it's really unfair.
Yeah,
like not
really.
discounting any other cancer, it's the same for everyone. But yeah, I think it's that little bit more complex, knowing everyone's like, are you in remission? It's like, well, no.
Yeah, no, it sucks.
No,
It sucks.
I'm okay, but no, I'm not in remission. Like it's an awkward answer, really.
Yeah, it just makes it also, I think, complicated in terms of recovery or kind of moving on with your life after treatment.
Exactly. And I've also got 2 young kids, so it's very difficult for them, especially my daughter's 8 and she likes to be very involved and in the know. So it's very difficult explaining to them that mummy's okay now, but like when they say, is the cancer going to come back? I can't say no.
Yeah.
But yeah, it's one of those things.
Yeah, that's so hard. It's so hard having those conversations. Yeah. And I guess I'm just a bit curious, with your treatment that you had, is that typical for your type of cancer? Or were you on a bit of an experimental treatment?
It's relatively typical. It's very difficult with sarcoma because it is rare. They don't have a solid treatment plan for it. I was very blessed in the sense that I got in with a sarcoma specialist in Canberra. So I went on the strongest protocol you can go on, so doxorubicin and ifosfamide, which is the typical treatment for sarcoma. But I have noticed in the couple people I've met, the way that's given and the dosage and the time frames are very, very different. And I think that's just because no one really knows how to treat it effectively.
Yeah, right. So it kind of is maybe a bit dependent on the doctor or them trying to make the best decision.
Yeah, absolutely. Yeah. But I feel really confident in my team and the protocol that I was given, because it knocked me for 6. So yeah, hopefully nothing survived that, because I nearly didn't. So
yeah, it sounded like it was brutal
treatment.
Yeah,
Ended up in, like I said earlier, I went into heart failure. I got fluid overloaded on my lungs, kidney, heart. So nasty drug.
Yeah, nasty, really nasty.
Yeah.
And what led you to choose to be a nurse? Because from, we were chatting just briefly before we started recording, and you'd been working in the army for a while, and then you made a change.
I've never actually wanted to do anything except be a nurse since I was about 8. I joined the army to do nursing, and then they said it was a 2-year wait. So I took a different path down Rayok and just kind of got stuck. Ended up having babies, loved the benefits of army, but yeah, it just became too much, and I really wanted to start doing something for me, and that was nursing. Yeah.
And when you started nursing, did you know that you wanted to work in oncology?
No. I said absolutely not. I have like a very strong family history of cancer in my family. I lost both my grandparents to cancers. So I actually specifically asked on nursing placement not to go to oncology. However, that's where I ended up, and I totally fell in love with it. So
yeah. What did you love about it? Because this was just before you got diagnosed. So what did you love about working there?
So I was after I graduated nursing, I was in oncology for 6 months as part of a graduate program before I went to surgery for 6 months. But the 6 months in oncology, all I've ever wanted to do in my life obviously was nurse, and just to make a difference. I know that sounds so cheesy, but making an impression on other people in their worst times. And also, it's not just nursing, you're counselling, you're looking after the family as well as the patient, like to provide that holistic care. But to be part of, I'm on the ward, which is where usually most of the end-of-life care happens, and to make a difference in the way someone's leaving the world, like that's huge, and I think it's just such an honour.
Yeah. No, it really is such an honour.
Yeah.
It's I can see what you mean. If you really want to be involved in making a difference, obviously all nurses are always making a difference wherever they work, but
absolutely,
that would definitely be a place where so much you could do so much. And I even remember from my own cancer experiences really taking notice of those nurses who seemed to be there for that little bit extra, like, because they did want to make a difference, or I felt like they had those soft skills that are key to actually make you feel comfortable and safe and supported. And it made such a difference as a patient.
And my brain as well, like the medications we have to give are so crazy, and like they can really impact someone. So I really like challenging myself, and it's a really good job in all aspects. So like the clinical thinking and skills, but also the personable side. And it's not just a get them in, get them out job. I just like the rapport and just really helping on all levels. I love it.
Yeah, that's amazing. That's so amazing. And so you got diagnosed and you were working as an oncology nurse.
No, so I was in surgical when I got diagnosed, but I got a job offer for permanent placement in oncology, and I was due to start there in 2 weeks before I got diagnosed. So I had to ring my boss and say, sorry, got cancer, might not be coming to work.
Yeah.
I did try to work. I think I managed to go to work 3 times during chemo, but I was just way too sick.
Yeah.
Look, when I managed to get back there part-time, during radiation, I told you before I'd go down and get radiation in my lunch breaks, which was super convenient.
Yeah, that sounds super convenient, but also kind of crazy.
Yeah,
That
look,
seems crazy to me.
because I'd go down there and my patients would be down there, and I'm like, oh, hi.
Yeah, that's true.
Yeah, look, it was hard. I remember one gentleman I think it was my first week back, and he was crying, really distressed, and just saying how he stopped chemo because of how sick it's made him. And he was telling me the chemo's killing me, and I was sitting there comforting him and just being like in the back of my head, like, I know, but it's not about me, it's about them. So unless people ask, I didn't really bring it up. But like, I'm an open book. I'm happy to answer anyone's question. And yeah, I happily had those confronting conversations with my patients. Obviously, I was at work bald, so it doesn't take people too much to know that I wasn't very well. I was still very thin and probably a bit sick looking, but
yeah. Did you notice? Did people kind of yeah, did you find people seeking you out, like patients seeking you out more? Do you feel like they felt a bit more connected to you for that reason, or?
I think that there were senses of like a bit more comfort, and I've always, I think, because the family history, I've always had little bit more understanding. But yeah, I feel like I've got a lot more to provide and more empathy toward them, and I might possibly treat them different to how I would have, because I know what worked for me, and the things I really appreciated when I was an inpatient as well. So yeah, it is good. I think the thing I struggled with most when I first started was being treated, I think, like I was going to break. That's really difficult for me because I was so desperately seeking normality. But also I'm so blessed that I work with such incredible people who just look out for me so much.
That's such an interesting point, actually.
Yeah, and I get it. I totally get it. But yeah, I was just, and also when we had people pass away, like everyone would be like, no, Kaela, like don't go in there. And I'm like, I am fine. Like, and my mindset with it is everybody's like DNA is so different. Everybody is different. No one has an identical cancer. So I did have to like pound that in my head a few times. And there are times I have a bit of a teary or need a couple days off, but most of the time I just am so happy to be helping.
Yeah, wow. I'm also, let's go back a tiny bit. I'm curious. You were telling me a bit before we started recording, but how was your, I guess, diagnosis story a little bit different to maybe other people because you were an oncology nurse?
Yeah, so I thought I had a sports injury because I was quite active in the gym. Felt a lump in my right thigh. And yeah, I went to the doctor and said, like, give me a cortisone injection. I've hurt my leg. Probably being a bit cocky being a nurse. And like I said before, every ache, bump I had previously rather, I would constantly be like, that's it, I've got cancer. Like, I'm done. This one, not 1 second. It never crossed my mind. Yeah, I went for an ultrasound and they said they needed to rule out a sarcoma. Even though I was an oncology nurse, I was like, what the hell's a sarcoma? Like, who gets cancer in their leg?
And also so young as well.
Yeah,
I think because we're
exactly.
young as well, it just never crosses your mind.
No, and I think there's so much education, which is fantastic, around like breast cancers and cervical cancers. And we do all those things, like monitoring and checking our breasts and getting pap smears and all the things we should be doing. But for cancers like that, there's really nothing. So I think that's my biggest thing out of this, is just any lump and bump, get it investigated. And even if you think it's a sports injury, and a lot of sarcoma patients actually say they think it's sports injuries, so they leave it, because
And
it
when you
does
say,
look like a soft bump.
yeah, so it's kind of like a soft bump. Does it often feel a bit like a bruise, or?
No, it didn't feel. I was getting pain in my hip, and it would radiate down my leg, and it was getting worse at night, and it got to the point where it was waking me up, and I was like, I really need to get this sprained muscle sorted. So yeah, I went to my GP, who sent me to the ultrasound, and yeah, just totally snowballed.
Yeah. Did you find, I don't know, did you have any, oops, I just kicked it. Did you have any, I guess I'm just curious about like any of your feelings or thought processes that you had once you kind of realized it was sarcoma, you were seeing the doctors, to kind of tell your team or to tell work, or?
Look, I was in a lot of shock, and I am in Canberra and all my family is elsewhere. So I was on my own.
So did you have to relocate for treatment?
No, nah, because I love my job so much. I wanted to stay here. My
I
kids
see.
settled in school. I did at one point try to relocate mid-treatment to Brisbane. However, I was told that no oncologist up there would touch me because of how rare my cancer was, how aggressive it was, and all the side effects I was having. So I was kind of stuck. But I think I had such a good support network at work, and I was so blessed to have such a good oncology team, and perhaps because I worked in oncology, it was a lot better.
You definitely knew that they were good.
Yeah. So I knew who to go to, and I knew I was getting the best treatment possible here, even though it was really hard mid-COVID. My mum was able to come down for the first chemo, and I'm kind of glad she left before it all went south, because it was really confronting. So I ended up in hospital, overdosed on chemo for 2.5 weeks, the first round.
Wow.
Yeah.
You must have been so sick. That would have been,
Yeah.
heartbreaking.
Yeah. Really bad. Yeah.
Yeah, I just have so much admiration for you, Kaela, that you're working and you're continuing to work in, as an oncology nurse. As those who watch me probably already know, but I'm a therapist, I'm a psychologist, and I've actually chosen not to see psycho-oncology clients. I just feel like I can't. It's every now and again I'll kind of check in with myself. I've been 5 years of remission. Hodgkin's lymphoma, is often touted as like the good cancer, or a cancer with a lot of very good recovery rates.
Yeah.
And so most people should be able to live a mostly normal life kind of thing. But still, even with all those factors, and even though with 5 years, I still really struggle. And it's interesting because I like make these videos, right? And I'm actually really wanting more support and more cancer support, especially for young people who have cancer, because that was a big thing for me. I didn't feel like there was enough, and I felt very isolated.
Our age group too is, we're kind of in the middle. Like there's Canteen and all those amazing organizations for the younger side of things.
Yeah.
But I'm in the you're kind of getting old, but you're still kind of young.
Yeah, the late 20s. Well, that's the thing as well, because I was 22 when I got diagnosed. So I just fit into the organizations, but then you age out very quickly. And all the long-term issues that you have, or all the struggles that you have, there's no longer that support. And even things like support groups, a lot of the time you have them for like breast cancer because women are awesome at coming together for that kind of support, but it's just breast cancer and that's different. It's just different. And yeah, I'm also not sure if the age groups would normally cover us, maybe just. Obviously, they'd be welcoming of everyone, but, you know, I'm not sure. So, yeah, and at the moment, I've just made that decision. Every now and again, I feel really bad for it too, because part of me thinks like I've got these skills, like I've just finished my master's, I'm going to become a clinical psychologist. Like I know psychologists who work in our youth cancer service, who are the psychologists that I would have seen. And part of me thinks like, what an amazing thing if you were a psychologist who had that experience and could work in that role for young people. But I've just had to, you know, have that self-compassion.
Yeah, and I think it's just such a personal decision. For me, I think I have coped a little bit better in like talking about it, because I think throughout the whole journey last year, I was just trying to survive, and I couldn't cope with discussing it, or like even when I went to work, it was really hard. But now that I'm out of treatment, I find it really therapeutic to discuss what's happened to me and share my story to promote that education and to help. But I also see that that's absolutely not for everyone, and everyone thinks I'm nuts for doing it. Sometimes I think I'm nuts too, and sometimes I need a few days to check myself and try and detach those emotions. But at the same time, I feel like I've got so much to give. And if this goes south, at least I know that I've given the bits of me that I know might help, or change not someone's path, but change their experience a little bit, I guess.
Yeah, definitely. And that's so admirable, like even just you sharing your story here, but also in the work that you do, you know, as an oncology nurse. You know, you would just be a different type of nurse, and that's really special.
Yeah, no, I just love it. I love my job, and I think if I didn't work with such a great team, it'd probably be different. But there's just so much support between us. I don't think there's enough support psych-wise for people in my area, but given we're all so close as a team, it's really helpful. Yeah,
and it's definitely one of those things that can become niche for psychologists, and there definitely needs to be more people who work in that area.
100%. Yeah. I mean, there's great support for patients, but not so much for the staff.
I see what you mean.
Yeah. That's interesting.
Really interesting. I guess I'm curious, Kaela, what do you think for those who are watching us who may be going through cancer or who have had cancer and they want to work in health professionals like a nurse or psychologist or someone who helps? What guidance would you give, I guess, to know to make the call or not, maybe to work in oncology? Or
I think with oncology, regardless of having cancer or not, I believe you need to be a certain type of person. Like not everyone's going to want to be an oncology nurse. Like it's pretty horrific. But that aside, it is beyond rewarding. Like you are literally changing the ending of someone's life, or you're comforting them and their families. Like their families are going to remember forever the way their loved ones were taken care of. And that's how I see it. That's how I care for people. I think if you're a nurse or you're studying, I'd probably suggest doing a placement there to start with, because if it gets too much, you can pull out. I don't know that I would go straight into oncology if you had cancer and you weren't sure how you deal with it. But I think if you know, you know, if that's the area you want to be in or not. But yeah, it's it's a really hard one. Some days I'm still like, what am I doing? I need to get out of this. But then a patient will come along that you can really impact, and then you remember why you're there.
Yeah. I think that's such a good bit of advice, to maybe also do a placement, try it out a bit, see how you go. Because the thing is as well, in these helping professions, they're quite draining in and of themselves. Obviously they're very rewarding, so that's why you do it, and they
outweighs it.
It definitely outweighs it. But when you're going through your own stuff, it can be sometimes hard to keep giving when you feel a bit empty yourself, because you're always working on yourself.
To find the ways to help yourself, like after work, like what works for you. Like I've started trying, I'm not very good at it, but I've started trying to meditate. And that is really helpful, actually. Or even,
me too.
Binge watching like Bridgerton or something. It really helps.
Something that's like true fantasy, like just something so different from life.
Escape reality. And I know sometimes I like have trouble sleeping. It's very difficult to switch off my mind. And I don't love meds unless it's scan time, then I will sedate myself happily. But rather than having meds before bed or something like that, I just like put on a podcast or some rain music or something to help me drift off. But I think another point on the whole working front is I notice a lot of women post-treatment are really scared to go back to work. But I think it's such a good thing. It provides that normality again. So I think the sooner you just get back on it and get back into work, it's really good for you. And my oncologist said as well, try and keep your normality as much as possible. And I think it's really, really important, no matter where you work.
Yeah, I think that's a really good point. And I think if you can, I would recommend also just starting with a few days.
Exactly.
Like if you used to work full time, just do 2 days or 3 days a week if you can. Because I know I kind of went straight into full-time work, dropped out entirely because it just like had a meltdown and couldn't cope, and then had like more time off because I was like processing that experience, and then started working I think 2 or 3 days a week, and you're kind of getting used to your own side effects that you've got to kind of live with now. And I had a lot of like still foggy brain. Is it chemo brain?
Chemo brain. Love that.
Yeah. So it took a while to, I guess, I think also feel competent.
Yes.
In your job when you're struggling with side effects. But I think you're right. You need to get back into it because that does help recovery too.
Absolutely. And I think sooner rather than later too is really good. But like you said, just a couple days a week and ease back in. Like my boss was amazing. I think I did 3 days a week for like 3-4 months. And now I'm up to like 4 days a week. And I think next roster I'll go up to 5. But just slowly. And if I need time off, just ask for it. Just look after yourself and your mental health. I think that's really important too. Talk about it.
Yeah, definitely. And I think for those of us as well who go through cancer and are really affected by it, and we really want to help, I think some of us can do that work that's very specific in oncology. And I think I realized for myself, I might come to a place where I feel like I can do that, or I might not, and that's okay. Exactly. And I think sometimes there is that pressure, sometimes even just to get into the helping professions. Like it's also okay if you just want to become like a singer, and you're not directly, I don't know, being in a helping profession, if that makes sense. But even if you do become like if you start working in a helping profession, that doesn't mean you have to work in oncology, and that's okay.
Exactly. 100%. Like I don't ever feel forced to be in the area I'm in. I already was, and it just so happens that I really love the job.
Yeah, that's true. That love was already there for you.
Exactly. So it wasn't something I felt I needed to chase. I think if I wasn't in it, I don't know that I could go into it. But I have spoken to other people who were diagnosed and then they're literally doing nursing just so they can go into oncology, and that's great. But I don't think there shouldn't be any pressure.
Yeah.
But yeah, my biggest thing is in my rehab, or my mental rehab, is like talking about it, like I said, because I feel like I was so silent for so long. But yeah, leading up to scans is a different story. I kind of just
that's me too.
Yeah.
It's
Yeah.
it feels safer somehow.
Yeah, it's coping. It's a coping mechanism, and that's okay. And that's the thing as well. It's okay to be angry and to cry and have your meltdown. Like, do it, feel it, go through the motions, just pick yourself back up.
Yeah, exactly. And like you said as well, to really prioritize self-care, whether or not you're in that profession, but especially if you're in that kind of profession.
Yeah. I went a bit crazy when I finished treatment, and I really gave myself some self-care.
Yeah.
I went and bought myself a Louis Vuitton that I've wanted forever. I was in trouble for it, and then I went and got a motorbike, and I got a miniature bearded dragon. I was like, okay, this self-care needs to stop. I'm going broke.
That's so good.
It's fine.
Was there anything that you wanted to add, Kaela, that you hadn't already spoken to?
Not really. I think my biggest thing is, if you feel a lump, and I know it gets said all the time, but for me, like, who gets cancer in your leg? Like, you can get cancer absolutely anywhere, your arm, your leg, your back. Like, if something doesn't feel right, pursue it. Especially with sarcoma as well, there are so many misdiagnoses because they don't see it. Like, doctors don't really see it. So if you have pains and they're not going away, push for those scans, push for the tests. You're the one who knows your body, and I can't stress that enough. Yeah. Listen to yourself. Yeah.
Well, thank you so much, Kaela, for coming on and chatting to me about this.
And also, if anyone has any questions or wants to talk to me, just reach out, because I am an open book and I'm not scared of answering any questions. So I'm all about that self-promotion and just pushing the education as far as I can. And yeah.
Where can they find you on the internet?
Instagram, probably the best. So it's just kaela.keo. Thank you so much. It was lovely to talk to you.
Yeah, really lovely talking to you too. And if anyone had like a really specific interest, or an extra topic that they wanted Kaela to speak to, then let me know in the comments, and I'll try to bring Kaela back if she's keen to maybe talk.
Always keen to chat.
Great. Well, thank you very much. See ya.
Bye.